Yeah, it's easy enough.
Ashley, can I have your help? What do you think I should do? Put the award out or in? What do people usually do? Because it's hard to get out.
Can you,
Or just present it
like, can it, are you wanting other people to see it?
Yeah, I guess when, because our dean is going to give the speaker the award,
Uh-huh.
so I guess when she announces it,
Can
have
it
it out.
Can it
do you think, Debbie? Would you prefer it out of the box right there?
Let's see, well, we could put it, I could take it out. We could put it on the
table.
table and maybe out. It's really pretty though.
Oh, that's a good call.
Take it out?
Take it out and move it on the table, and
Okay.
then afterwards, we can give her the
Maybe,
box.
yeah.
to
Shame
carry
came.
them in.
It's really tricky.
Oh, you're not kidding. Wow.
I don't want to break them, that's what I'm scared.
Yeah. There you go. Progress.
It's like, I have to like beg for a table, I'm like, oh, I forgot about the table. Thank you. It's not completely done.
I'm trying to see if I can push some of this back for you. But it's just styrofoam under all this crazy velvet.
I don't know, we may just have to leave it, because it's pretty, I mean, it's pretty in the box. It's pretty in the box, it's got nice, lovely.
Okay, let's do that. That's good.
Was it just open like that? Is that where it was? Okay. And then, a forward for you, okay. And I just
Oh,
added
you
some,
did your.
I just did some spacing, I didn't really change anything, but I wasn't
I
sure.
do that too. I
I
double
didn't
space
know
mine.
if there was room, so I'll leave that right there, and then I don't have to worry about it. And where are
Do
we?
you have the award card?
Yes.
Okay, yeah.
Phew. I was like, yeah, because we got changed.
Yes, yes,
And I'll bring that with me. So we're like, am I the first speaker? Like everybody comes in, sits down, so do you want me over there? or-
Yes, why don't you and
Yeah.
Donna and I take those first three
Okay.
seats?
Okay.
Yes. Hey, Ronnie, how
Hey,
are
Ronnie.
you?
How's everybody?
We're doing
Great.
well, doing well. Yeah, I guess it's time.
I got quite a few photos out there.
Thank you, Ronnie.
Crap.
Thank you, yes. Because,
Are you
speaker
in?
wanted that. Okay. Good, here. Awesome. And for the questions at the end, I see we have a where's the mic there? Is someone? Where's the mic? It's right here. Do we have a, is someone, here it is. She's doing, okay.
Oh, good, so I can just pick this up when it's Q&A time and wander around and turn it on. Okay.
It's wireless and
This arthritis.
Oh, yeah, I have RA. I
Oh.
understand. I completely understand.
Oh,
It's not
wow.
popped up too bad today. So, my
Yeah.
Enbrel's working.
What about side effects?
No, I don't have any really from the Enbrel, which is good.
That's great.
Mhm.
That's great.
The methotrexate was terrible on me, and it changed my taste. I can't have anything spicy anymore. Even like a very mild buffalo will burn me up. Now, how weird is that?
Yeah. Wow.
I used to be one of those people who would eat, you remember, and this will tell my age, those hot fries you could get, the Andy's hot fries. I ate a whole bag of those suckers, right?
Ouch.
But I'm not
Nothing
touch
wrong.
one now. Yeah, I want to like burn up.
Wow. Good. Well, I guess we could be live in there. So just need to be careful what I say.
Yeah.
I think Thursday, the meeting with the dean is like 11 or so. Are you available to attend or?
Thursday,
I think it says Thursday.
we're in Sigma.
That's right, there's gonna be a bunch of people, that's the reason.
That's the reason.
Yeah, that's, you know,
Otherwise, I'd love to come.
well, I'm hoping to just hear back from her, you know, like, I don't think it's gonna be, but with just, there's so, yesterday I got a message from Dr. Hall saying, did your committee do anything about faculty awards? No. What else? Tenure, promotion, work. It's like,
I wondered about
So,
that. I wondered
yeah.
if, so are we sending something out?
I guess I will. I will have to get their blessing first and then do that. But this week we sent out, you know, nominations for officers for next year.
Yep.
So is that something you'd be interested in?
I thought about it. I really did. I don't know what I would do. So, yeah, I thought about it.
Yeah, I mean, the secretary is just busy, but, you know, putting yourself in a leader position for vice presidents, you know, or vice chair would be a possibility. I feel like I have done nothing but faculty affairs and accomplished nothing. You know, it's just been super.
That's okay. Remember, you started from zero.
Yeah.
So, if we start from zero, and even if you're at 25, you're way ahead of what we were. You see? So please don't feel bad because, wow.
What a strange thing though for a new dean to come in and put workload and tenure promotion on hold. Don't do, disband it.
And faculty search. Yes. Because she didn't want that I would be honest. That's the
You
truth.
get in trouble for that,
I
don't
do
you?
a lot.
Apparently.
Yeah. But, you know where you stand with me. I'm not one of those people who will be smiling to your face and stabbing you in the back. You know? And that's okay.
Well, so how are things with you? You know, every time I see you, all I can think of is Kathleen and what she threatened you with. I'll tell them this, and who are they going to believe? I mean, just, you know, just evil.
And, I helped start that program. There is literally only 2 people left that started that program.
Is she still
No,
there?
I don't think there's anybody left, actually.
Is she still there?
Yes.
Really? So she's continuing to work.
I don't know.
So people, what she's like.
There's Did you?
Yeah, I was in, I went to Melissa's, not Melissa, I went to Jean Hemprill's office and we were listening in there.
And then it couldn't work out better with, they
It's
were
like
lower.
with my, like, the grant that I'm doing right now, I get 50%, I don't get
She
the
don't
rest.
get her tenure thing. They took that away from her.
I've not had it in like 2 or 3 years.
Yeah.
So they're putting in the grant and they can, no one can find any policy for it. So I
find a seat. We are going to live stream the presentation into the lobby. The lobby's very comfortable. We've got seats and tables. So any of you, we cannot have, for fire regulations, we cannot have folks standing. So if you don't have a seat, feel free to watch in the lobby.
Sure, if we're on yet, and I definitely am someone that needs a microphone. Roddy, are we on? Well, good morning and welcome to the second annual Pattie Browder Lectureship. I'm so pleased to see so many of you here today. You're joined by many of our nursing students, our faculty, and our staff members. And we have several very special guests in attendance as well. The College of Nursing is very grateful to offer this opportunity through the endowment established by Dr. William Browder in memory of his late wife, Pattie Browder. The lectureship recognizes Pattie's commitment to nursing principles throughout her life, and the family's aim in sponsoring the annual lecture is to emphasize a nurse's impact on others, even in their own life circumstances. At this time, I'd like to ask Dr. Browder and their daughter, Megan, to please stand and be recognized. It is now my pleasure to introduce Dr. Donna Roberson. Dr. Roberson is Professor and Executive Director of Program Evaluation for the East Carolina University College of Nursing in Greenville, South Carolina. She is the ECU liaison to the Research Education Component Core at Duke, UNC Alzheimer's Disease Research Center, and is an alumna of the Robert Wood Johnson Nurse Faculty Scholars. Dr. Roberson attained a PhD in nursing from the University of North Carolina at Chapel Hill, and both her MSN and BSN from East Carolina. She and her husband have 3 adult children and 2 grandsons.
We have loved having the opportunity to get to know Dr. Roberson over the last couple of days, and we look forward to her presentation entitled Owen's Story, the Critical Importance of Nurses in the Role of Patient and Family Advocate. Please join me in welcoming Dr. Donna Roberson.
Thank you. Good morning, everyone. Who has heard of Nurse Blake? What does Nurse Blake do at the beginning of all of his shows? All right, selfie time. All right. I have known Nurse Blake. But I am very, very honored and pleased and proud to be here today to talk to you. I am from Eastern North Carolina at East Carolina University. We are the Pirates, and I'm speaking to the Buccaneers. So we're kindred spirits. Our colors are purple and gold. And usually when I speak, I wear purple and gold, but since we're sister schools, I'm wearing the navy and gold today. So I've told some of the students that are here today, I hated nursing school. Hated it. But I loved clinical, and I loved lab. So if you're not so fond of the classroom, but you love clinical, you're in the right profession. And the wonderful thing about nursing is that you can be so many things. And you can change. You don't have to do the same thing all the time. So I don't like to read slides. I hope this is kind of small. But those of you that are in scrubs, let me introduce you to the pinstripe pinafore uniform and the nurse's cap. That was my graduation picture. I was just fresh and young, had no idea what was going on, but I knew I wanted to be a nurse. Nurses, again, in 2024, 78% of those polled by the Gallup agency said that nurses were the most trusted profession. And that's big. It's been, I don't even know how many years in a row, nurses are the most trusted profession. These are some of the roles that nurses serve in. Advocate is certainly a big one, but we're also educators. There's some of my colleagues at a graduation ceremony, we get to wear a regalia to honor our students. Humorous. Can you tell this was during COVID? It was my birthday, and I was swabbing noses. It was fun. But some of my friends went and bought birthday balloons. You know, it makes fun, right? Make it fun. I do a lot of different things. I am a family nurse practitioner, so that's my excuse for doing a lot of different things. I do HIV prevention and aging well with HIV, and so this is an HIV team with me. And then I also do family caregiver support, and so that has to do with Alzheimer's disease and dementia care. I am also a nurse practitioner. I work in student health at ECU, and this is one of my students, and she just had a baby this week. Well, end of last week. And then this is one of my favorite mentors, Dr. Beverly Malone, and some of you may recognize her from the NLM. And I was very blessed to get to know her and to be influenced by her. Nurses are also family and friends. And this is my family. On the left is, I can say this now, these two on the end are now fiancés. He proposed, this is CJ, proposed to my daughter Hannah. It's my husband Doug in the back. And then my daughter-in-law Grayson with William Christopher Topher. My son Zach, he's the middle child. I'm holding Owen, so you know this has a happy ending today. And that is my daughter-in-law Nina, who is a CVICU nurse and now works in a clinic setting with people who have implanted devices. And my oldest son John. And then there's my dad. My dad taught me to not be afraid to speak out for what I know is right. So my mother also told me that, but I'm a daddy's girl, so I paid more attention to him. And these are pictures of some of my very best friends. I told a table, you don't know, your lifelong best friend may be sitting at the table with you this morning. And this is a picture of my best friend, Darlene. We've been best friends since nursing school. And for graduation, we got to wear white dresses. And our male classmates got to wear a white long tunic and white pants. And of course, our caps. But this is my friend Janice Neal. And my friend, Janice is in that one too, Linda Bolin and Mark Hand. And I would not have made it through this story without those friends, because they're all nurses, and they were able to advocate and reassure me when I had difficulty doing so. Just when I thought I was fulfilled in everything, all my roles, nurse practitioner, nurse, researcher, faculty, I'm fine, right? But then this happened. Please say all. This is my very first grandson. This is Owen Douglas, and I'm going to tell you, this is his dad, my son John. When your baby has a baby, it hits different. It really is something. And of course, was the most perfect baby in every way. Aren't all babies. But we were very, very excited and pleased and proud to have Mr. Owen join our lives. Oh, good. Those pictures better. Okay. So, Owen, for the first year of his life, really lived basically in the house with us as my son and daughter-in-law because of COVID. A lot of this is because of COVID. There was some delays on their house getting built, so they lived with us. So I really was blessed to get to spend a lot of time with Owen. In August of 2021, I started noticing, it's kind of hard to tell in this picture, but Owen started curling up his left hand when he was crawling. And I thought, that's not right. But you don't go, he must have a brain tumor, because that is rare. That is weird. You don't look, when you hear horses, you hear the hoof beats, you don't look for zebras. You look for quarter horses, right? So I was just thinking maybe he hurt himself, and I didn't want to be that grandma who, was saying, oh, there's something wrong. I didn't want to be that person, so I didn't say anything. But then it became pretty obvious, and in the fall, my son and daughter-in-law took Owen to see his family nurse practitioner who works in pediatrics, and she said, well, maybe he hurt his arm at daycare because he was getting where he wasn't using that arm. It was just kind of hanging there. So he went to physical therapy, he went to occupational therapy, he got worked up, and they decided PT was going to be good. And he did get some strength in his left arm with PT. So, we thought we were good. But then one day I noticed Owen was dragging his left foot when he was walking. So his left arm's hanging, he's dragging his left foot. And I said, something is wrong with this baby. Something is wrong. And neither of my son or daughter-in-law could take Owen to see our nurse practitioner that cares for him. And I said, I'll take him. And so I stood him in the back of the exam room. When she opened the door, she was like, hey, one of my former students. I know her well. I said, stay there. And I went over beside her and I said, Owen, come here. Come to Mama D. And he drug that left leg across the exam room to her, and she went, oh no, this is not right. And so she was able, I don't know if you know this or not, but getting in with a specialist is next to impossible. If she had referred us to neurology, it would have been a long time. Thankfully, she knew this. And she ordered the MRI and referred us to a neurosurgeon. And it moves very quickly. February 24th, 2022, sitting in a rural health symposium, I got a phone call that made me unable to think like a nurse. And it was my son who said, "Mom, Owen has a brain tumor. Get over here right now." And so there's only one hospital in Greenville. And I knew he was had the appointment. I knew he was having the MRI. And so I ran in and I grabbed my stuff, and one of my colleagues said, "What's wrong?" And I said, "Owen has a brain tumor, pray." And I went running to the hospital. And so this is what I found when I got there. And we were told that it's the patient record and we're not allowed to take pictures of the MRI. Oops. I've taken a lot of MRI pictures with my phone. So you can see that there's definitely a mass in there. And then this MRI shows this little sort of medium-sized tumor, I would say, attached to the dura, the lining around the brain, and there's a giant cyst and a pocket of fluid that was collecting in that cyst. And you can see the whole right side of his brain is pushed over to the left. That's why he was having left-sided weakness and manifestation there. They wouldn't let us leave the hospital because something bad was imminently going to happen to him. He was going to have a catastrophic stroke, a seizure, something bad was going to happen. So they sent him for a CT. I begged her to take it out right that minute, and the neurosurgeon said, "Well, no, we have to do other things first. We've got you. You're here." But they put the markers, they went to CT and placed the markers to guide the surgeon. And then it's hard to see in that picture, but Nina is devastated. And John is devastated, but this is a mechanical engineer, y'all. And he was our rock. He kept everybody informed. We were under COVID precautions. And the rules at our hospital was you can have 4 visitors, period, the whole time you're in for this admission. 2 at a time in the room. You can rotate out. But you can't substitute. You got to pick 4 people. And so my son spent a lot of time explaining to non-medical people what was going on with Owen and keeping the family informed and up to date. While Nina and I, the only way I can describe it is we were just in shock. Just in complete shock. Now, I'll put warnings up here because some people are not medical and some people are uncomfortable seeing post-operative pictures. But I want you to just see kind of the progression of what happened with Owen. He was supposed to be in surgery 12 to 14 hours. They took him early the morning that they did the surgery, and he was out by 2 o'clock. And very quickly, Mom and Daddy saw him, and then they switched with me and Nina's mother, the other grandmother. And now this picture of Owen with an endotracheal tube or a breathing tube, he's hooked to a ventilator, he looks fantastic. So if you're like, "Oh no, that poor baby with that tube in his mouth," he looks great. He's pink. He looked peaceful. He wasn't struggling. He looked great. I was so relieved. The nurse was like, did come out a little bit, so relieved. That was at around, well, when did I get in there? I was at 14:26. Don't you love a phone tell you what time you took a picture? All right, so 2:26, the day he had surgery, that's how he looked. The next morning when I got in there, around 7:30, the night nurse and the PICU, the Pediatric Intensive Care Unit, had got him off the ventilator, got him extubated. He had a little bit of swelling in that right eye, to be expected after surgery, but he was watching Bluey. Anybody know about Bluey? If you're going to be in Peds, you got to know about Bluey. And he was fine. And he had his Vivo. That's what he calls his pacifier. By 5 o'clock that night, this baby, who has not used his left arm in months, reaches his left hand up to touch his daddy's face and is smiling at him. We're so relieved. We don't know what that tumor is, but at least little Owen is still with us. And then a few days later, they allowed us to clamp his drain, his intracranial drain, and he could sit in your lap. And let me tell you, nothing felt better than holding this baby in my lap. It was great. And I don't know if you can see, there's red at the top of that little hat. They made him in the OR. The CRNA made that hat. And when his nurse mama and his nurse grandmama saw it, we both thought he was bleeding, but it was a heart. It was a red heart. We never left Owen alone. And I know everyone doesn't have that luxury when their child is in the hospital, but Nurse Pattie Browder did not leave her baby alone. And I didn't know her at the time, but I know how that felt. Baby will not be left alone. And there's magical people at the hospital. There's wonderful team members. And I came to understand that the child life specialist was critical to success in anything with a pediatric patient. And so I knew they were important. I knew that they brought games to kids. They set up Nintendo or PlayStation, whatever. I'm showing my age a little bit talking about a Nintendo, right? But I had no idea that they would come in and distract a child for IV sticks, dressing changes, things. I mean, they're there for it all. They're in the trenches with us, and they are fantastic. The other fantastic thing is the family-centered care model. Has anybody seen that in their practice or in clinical, a true family-centered care model? Some people are nodding their head. So at the PICU, there's always an attending physician, and there's always a resident or two, a resident physician in training. In the daytime, there's 2 nurse practitioners, and at night, there's 1 nurse practitioner. There's somebody on the floor all the time in the PICU, so there's no waiting for someone to come to help. Everybody is there all the time. And they do this wonderful thing called rounds, and the family is included. And they listen to their nurses. The nurses are an active part of the care team. This was the textbook perfect picture of advocacy, family-centered care, respect for other disciplines that I hope all of you students are learning and experience, which I can tell you as a new nurse, not so much. There was a lot of my physician colleagues that had to learn to trust me, but in general, the nurse was to assist them and do what they said, and that was the end of it. That's not how this worked. So the first day, it's me and my daughter-in-law, and they're doing rounds, and the attending physician sticks her head in the door and says, "Which one of you is joining us for rounds this morning on Owen?" And my daughter-in-law went, "You." I said, "Yeah, I'll go, sure." Now, at this point, we didn't know what kind of tumor Owen had. The only thing I was worried about right that minute was his sodium was low. And I knew why it was low, and I was getting him to eat Lay's potato chips, drink Pepsi, no water, giving milk, things that's got higher sodium content. And so the nurse is standing, our favorite nurse, she's still a support today, standing beside of me, and the attending says, "Okay, present Owen." And they start presenting their pieces, and then the labs are mentioned. And the attending says, "Why would Owen's sodium be low?" There's 2 nurse practitioners, resident physician, me and the nurse, and the child life person standing at the back. And they're looking at each other. And the nurse hits me with her elbow. And I said, "Decadron? He's on a big steroid because he's had brain surgery to reduce risk of seizure and inflammation, depletes your sodium." That's a test question, students. What electrolyte can be affected by high doses of corticosteroids? So the attending went, "Good job, Mama D." And everybody else was like, "Oh, yeah." So it was a little funny thing, but I was included. I was respected. The nurse knew I knew. We had already talked about it. I knew she knew. So, you know, we think things are going along pretty good. We're getting a lot of progress. This is Owen with his left arm holding his stuffed animal. Let's see. That one's the giraffe. He is a cowboy. He likes cows. He doesn't ride the range. Okay? But he likes stuffed animals that have a long tag. He's a very tactile person, and he likes to rub the tag. So that's his left arm hitting me with a giraffe, which I was thrilled, because he was really using his left arm. Now, he is eating right-handed there, but he's sitting up in a chair feeding himself. And as you can see, his drain's out. By the way, the incision and the site where the drain came out looks great. It looks fantastic. He's feeding himself left-handed there. Meanwhile, it's March 13th, and Zachary and Grayson have the arrival of William Christopher. When your baby has a baby, it hits different. And I was able to be there because even though it was COVID precautions, I taught all the L&D nurses that were in there. It was right at change of shift, of course, and I'm kind of like trying to be real quiet so nobody notices that I'm like the fourth family member in the room. And the physician comes in, the OBGYN, and goes, "Great, the whole family's here. It's just like it used to be." So I was like, yeah. So that was fantastic. Good news, beautiful baby. We got to move out to the step-down unit, which I was a little upset about because I understood we could be discharged home from the PICU, and I really, really, really liked our PICU care. But no, they needed the bed. We had to move to the step-down unit. But those nurses were great. And they said, never mind COVID precautions. We are going to advocate to get permission so that you can take Owen outside, because nobody in the family had seen him for a month. And that is a really, really long time in a 17-month-old's life. So they advocated. We got to go outside, got to be with more of the family. But as you can see in this circled area, Owen developed a pocket of fluid under his incision, a seroma. Very common after drains are removed. And it was getting a little bigger and tighter, and it could open the incision. So the neurosurgeon put a little dressing on his head to put a little pressure on that to try to help it resorb. And then there's John and my husband holding him. We got to go outside. So everything was good. It was time to go. They decided that he would benefit from inpatient pediatric rehab so he could be strong. And again, I didn't want to leave our nurses because I really liked them and I liked how they advocated for us. On the way to the rehab unit, Owen pulled his dressing off his head. Imagine this. An 18-month-old doesn't like something wrapped around their head. So he ripped it off. And when they got us down there, I was not there. It was my son and daughter-in-law. The neurosurgeon had to come and replace it and did not allow my daughter-in-law and my son to be in the room, which was unusual. And we heard him screaming. Child life was also not called to be in that room. There was a nurse in there, and we could hear him screaming and crying, and the neurosurgeon walks out and says, "Everything's fine," and left. The nurse walked out and had this terrible look on her face, and she said, "I'm going to go get Tylenol." And this is my opinion, but I believe that the neurosurgeon was angry and wrapped that pressure dressing around Owen's head in anger. So this is what we dealt with for the entire weekend. And it just illustrates the danger of not communicating, not listening, disempowering the nurses, the therapists, and the family. So that whole weekend, he was in terrible pain. And I can't tell you how many miles I walked. If we walked him in the stroller or in their little push cars, he could tolerate it. If we went outside and, he could play a little bit, he could tolerate it. He would get into therapy and the PTs were like, he's in too much pain. He's not going to be able to do this. They documented it. They shared it. The nurses were documenting it. Every time they could give him Tylenol, they gave him Tylenol. Like, we didn't even ask for it. They knew. Saturday afternoon, the dressing was placed on Friday. Saturday afternoon, my daughter-in-law were in there with Owen, and we talked about taking that dressing off. We knew something was wrong. But, unfortunately, or fortunately, who knows what would have happened, we decided to trust the process and to just try to comfort Owen the best we could. The next morning when the residents came around, they saw me pushing Owen in the hallway and said, "Oh, Grandma, how's Owen doing?" I said, "He's not doing good. He's in a lot of pain. And his parents are in the room, and maybe you'd like to talk to them." They did not even acknowledge that comment and turn around and walked off. They never touched him, looked at him, nothing. The nurses had been calling the person on call, that they had been doing everything that they could to no avail. Our fear about taking the dressing off was, what if it caused a rebound of that fluid and it popped his incision open and he got an infection and it went in his brain and it killed him? Because that's how my mind works as a nurse. I can go down a rabbit trail of worst case scenario in a heartbeat. Never in my wildest imaginations did I think he was developing a pressure wound all around his head. So, graphic photos. I went to work on Monday, and about 4 o'clock in the afternoon, my son called and said, "Mom, you got to get over here." Like, I can't take many more phone calls from John that says, "Mom, you gotta," because, I just can't take much more of that. And I said, "What's wrong?" And he said, "I sent you a picture." Well, I'm in a building that doesn't let you get your pictures. So I walked to the door, and it downloaded. And this is what I saw. So I got in my car, and fortunately or unfortunately, I taught a lot of people at our local hospital, and I know a lot of people. And I called everybody I could think of and said, "I'm on my way. That neurosurgeon better be there. I want plastics. I want wound. I want the nurse manager. I want everybody in that room when I get there." And my friend in risk management says, "If you go in there loaded for bear, they're not going to let you in." I said, "Then I will be interviewed by all 3 television stations in front of the fill-in-the-blank hospital sign and tell them what happened." So, again, the neurosurgeon took the dressing off without my son and daughter-in-law in there, came out and said, "Owen has a little skin irritation," and scooted. So, I'll just tell you, I called that person a coward, and that they had to get back over there. We would not be satisfied until the neurosurgeon came back. But you can see his whole forehead is a pressure wound. Right beside, really on part of his incision that was healing beautifully, there's a pressure wound. It's on the side of his head, and it's also around the back and on the other side of his head. Now let me tell you, Owen was happy as a clam. Because he wasn't hurting. Well, all the nerves are damaged now. But he was not hurting. He was just happy as he could be. I was trying to do creative hairstyles to keep his hair out of his wound. And you can kind of see in that picture, his eye was very swollen. And yes, the plastic surgeon came, the wound specialist came, the wound care nurse, I taught in nursing school, she came, the nurse manager, I taught in nursing school, came, the nursing administrator, we're in the honor society together, she came, no neurosurgeon. Sent their PA to talk to us. And I said, "Let me just stop you right here. There is nothing you can say or do that will make this situation any different. Call your neurosurgeon and tell them they need to get here. So finally, the neurosurgeon came, and everybody left. There was, I think the nurse manager stayed, and the neurosurgeon said, I'm sorry. But do you know what their excuse was? It was the weekend, and I can't work 24 hours a day, 7 days a week. And I said, but you have the ability to give a report and ask your on-call person to check on this patient. What could she say? So this is the next day. It starts drying in, and you can see the left side of his head. So today, Owen has no hair on any of those places because it is permanently scarred. There's no hair. His forehead is, I believed the plastics person because I knew him when he was a surgical resident and I was a nurse at the hospital. And he said, we don't want to be in any rush to do plastic surgery because little people do a lot of healing and we don't want to put him through it. I even went so far as to say, he had told us if he did something to the forehead, it would have to be a full thickness graft. Meaning it's not just the skin to cover, it's got to be deeper part of tissue. And I said, can you use my stomach? He says he takes it from the abdomen. I said, can you use me? Because I just couldn't bear the thought of him having surgery like that. And he's not a touchy-feely person, but he hugged me and he said, just wait. Trust me, just wait. Well, I kind of wasn't feeling trustful right that moment in time. So we went from being in sheer panic mode, Owen has a brain tumor, to wow, he's using his left side again, we're feeling a little better, to Owen has this horrible wound. Then the oncologist comes in, and I love this oncologist. She trained in this place called St. Jude's. Y'all know about that place? And she came in, and this is how she starts her conversation. It's good news. And then she sat down, so we were all like, because we knew we had the results. It took forever to get those results of the genotyping. They sent it to the Mayo Clinic. Do you think the Mayo Clinic we could trust with genetic typing? Yeah, right? She says there are 5 mutations that cause this type of brain tumor to come back. Owen has none of those. So he's essentially cured. He's going to be monitored. We'll do MRIs periodically, and then we'll go out to annually, and I'll follow him till he's 25, and then, he'll be off the hook of medical care. So we're really happy about that. Owen feels better. We're okay. We're okay. We're going to do dressing changes. We're going to go home. It's going to be all right. But the nurses, Mama and Mama D, we were struggling. And I'm trying not to struggle anymore, but some days I struggle. We felt enormous guilt. How could we as nurses not see this and know this? Trauma is real. And we were feeling it. The rest of the family was angry. They were frustrated. But we had that good news. It wasn't going to come back. We were going to be all right. Then it was time for a post-op MRI. And now I can't think like a nurse again. Because of this little area circled over here, lit up bright white on the MRI. And we were told on the Friday before Memorial Day, always a Friday before a long holiday weekend, right? That he, in fact, has a glioblastoma, the worst possible scenario, and he's going to die. My daughter-in-law asked the neurosurgeon, are you telling me my baby's going to die? And the neurosurgeon said, yes. So, we're not so worried about that wound anymore. And we're freaking out, grieving. I mowed the yard for probably 8 hours. I have a riding lawnmower that's my therapy. So I was riding that lawnmower. Meanwhile, Owen looks great. He's kissing his baby cousin. He gets to go swimming. We found a waterproof cap he could wear. He's standing on my son, actually, in that picture. But my daughter-in-law is just devastated laying on the couch back there. And we had canceled an appointment to see somebody at Duke that was a pediatric neuro-oncologist because he's dying of a glioblastoma. He's got to have a line put in. He's got to have this really bad chemo. It's going to make him deaf. He will be deaf. He's probably going to have numbness and tingling in his hands and feet for the rest of his life. He's going to be immunosuppressed. We've got to protect him if he gets an infection that could kill him. None of those things happened because of advocacy. So first of all, the PICU nurses and other nurses were a great advocate to Nina and I to not beat ourselves up, but we are okay. We're okay. And you can't think when it's somebody that you love sometimes. Owen's family nurse practitioner. Yes, I know her, but she will do this for any family in crisis. She is a tremendous advocate. Constant texting, messaging, stayed in contact, looked through the chart, told us if she saw something, and would bring us in and talk to us. Fantastic advocacy there. The oncologist was very much an advocate. However, there was advocacy that was unexpected. The MRI technician, because now we're buying MRIs frequently, right? There was an MRI technician that just fell in love with Owen, and whenever he saw Owen was on the schedule, he still makes sure that he's around if possible. And the day surgery nurses, they would have everything set up so that when we came in the room, it was bam, 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 and Owen was out the door. He didn't have time to get worked up. And that was tremendously helpful. And then one day, I'm sitting in my Alzheimer's disease group, and they're like, what's going on with Owen? Well, he's going to have to start chemo. He's got a glioblastoma. He's going to die. We're trying to keep him alive long enough to get him old enough to have radiation therapy. That's going to stunt his growth. It was horrible. And there's a PhD on our team that is not a healthcare provider. He's a scientist. And he starts messaging me, did it have these mutations? And I said, no. And he said, okay. That afternoon, the pediatric neuro-oncology specialist called my son 3 times. Now, those of you that's been a nurse for a while, you know specialists do not try 3 times to call somebody. But this person did. And my son finally answered the phone and said, look, I'm sorry I canceled the appointment. You know, all this is going on. And he said, let me stop you right there, John. Do not give this baby chemo. Do not let them do this to him. I have seen this before. It's inflammation. You need to get them to repeat the MRI in 8 weeks. That's not going to be detrimental to him. So like now what do we do? But the oncologist agreed, but she was not willing to wait 8 weeks. So 6 weeks later, gets an MRI, and then we get a miracle. So this is before. This is 18 months later. There's a little cyst still there with some fluid in it. This is in February of 2024. He's healed. It was not a glioblastoma. And the cyst is gone. His forehead wound is hardly noticeable. And now we got to go into disciplining this 3-year-old who we let get away with a lot of things because we thought he was going to die. Now I have to be beheaded. So I can think like a nurse again. That, you know, he's making fish pictures out of his hands and he's playing with his cousin and being like his daddy and sticking his tongue out for photos and sitting in mud puddles and you know, it's all good. It's wonderful. So, in February of 2024, Owen had seizures. And because he'd never had seizures before, we, of course, had him transported to the hospital, and it was determined that he has partial seizures, and it's from the scarring. Even though it had been 2 years, the scarring had just now decided it was going to disrupt electrical flow. So he did not have epilepsy, grand mal, tonic-clonic. He just basically stared to the side and drooled a little bit, and then in 20-25 seconds, he was very tired, but he was okay. This is what your hair looks like after you wear EEG leads all night, and they take them off. They use this fantastical glue stuff. But, I mean, you can see his forehead. If you didn't know, you would just your eyes would slip by that, I think. It's not bad, right? So let's have a little education. Owen had a desmoplastic infantile glioma, which is one of the rarest brain tumors. It's seen in children less than 18 months of age. And as long as it doesn't have certain genetic features, it is going to be cured, typically by surgery. If it's not, it was very superficial, just on the dura, the lining of the brain. So that was actually the best possible scenario. Until 1987, they thought it was an astrocytoma, which is in the bad tumor categories, but they discovered it was unique and had unique pathology, so they called it a dig. But you can have some outcomes from brain surgery that would include the seizure disorder. So how many of you are nurse advocates right now? How many of you think you don't know enough to be a nurse advocate? Yeah, well, you do. I don't care if you're first semester, you do. These researchers asked nurses to define what nurse advocate means to them. What does it mean to be a nurse advocate? Promote patient safety and quality care. First semester students, do you promote patient safety and quality care? Then you are an advocate. So you should raise your hand. You protect the patient and be their voice when necessary. That's coming first semester. You'll feel more comfortable doing that. Third semester, y'all got this. We educate the patient and family so that we can help them advocate for themselves. There's actually a certification you can get in being a formal nurse advocate, but I'll tell you the informal nurse advocates are where the gold is. That's the treasure. That's what's important. So lessons learned from us that I want you to take with you. Hindsight is 20/20 vision. It does not serve any purpose or make you heal or feel any better to say woulda, coulda, shoulda. Let it go. But never underestimate the importance of intuition. If you think something's not right, something's not right. Sound the alarm. Call the team. Ask another nurse. Something's not right. Listen to that. Nurse Pattie listened to that. And now we have Megan here alive and well. Listen to that inner voice. If the family looks okay, don't assume they're okay. Especially if they're medical people. Because we were real good at making it look like we had it together. And we all thought each other had it together and none of us had it together. It was tough. Ask, listen, don't be afraid to touch. Now, I say that with a grain of salt. You don't just run in and hug somebody. You ask permission. But touch is powerful, particularly when someone's overwhelmed. And if a family of a child says something is wrong, something is wrong. Something is wrong. They know. Pay attention to that. Advocate to the medical team. Use your chain of command. And if the next in line is not listening to you nurses, call the next person and the next person till you call the CEO of the hospital if you have to. Advocate for your patients. Make sure that you share the stories with permission of the good, the bad, and ugly. So I'm going to say this is a good story, and feel free to share it. I went to this presentation and I heard about this little baby named Owen. Owen is Facebook famous. I cannot tell you how many times his story was shared. I was at a little store with Owen's mama and Owen, and he's running around, and I said, Owen, come back to Mama D. And this woman whipped around and went, is that baby Owen? My Sunday school class is praying for him. And I said, well, keep it up. It's working. I gotta find this 2-year-old. So, I give my sincere thanks to the Browder family for making this possible, for inviting me, for the faculty of our College of Nursing here, for inviting me to come and allowing me to share this story. Kind of proud I didn't cry. I thought I was going to cry. And I welcome you to ask questions. Or if you have a quick story of a nurse advocate. Anyone?
Was there legal action brought against the neurosurgeon?
I didn't sign a non-disclosure agreement. Those kind of things, when it's pretty obvious that there was responsibility on behalf of the agency, they typically try to avoid that going all the way to court. I'll say that. I will say that it has been communicated to us many, many times. The neurosurgeon has totally changed practice and does not do pressure dressings, and that is totally different. And guess what? I taught one of the nurses in the rehab center. She told me that they now include the nurses on rounds, and they ask the nurses, were there any concerns in the last 24 hours? And just because you're in rehab doesn't mean you're 1 foot away from your house. There still could be things wrong. So a lot of good changes came from this. Yes, ma'am?
Did any of the nurses do anything specific to help you all feel better about the whole situation?
So did any of the nurses help us, intervene with us to help us feel better?
Well, do anything like specifically that made you all feel better about?
I think she wants to know, was anything done specifically to make us feel better? The evening that my husband and I were pushing Owen in the stroller and there was no dressing on his wound, we saw our favorite PICU nurse, and she came up and she was like, what happened? And so I just kind of quickly told her the story, and she sat down on the chair beside me and she put her arm around me and she said, you have not done anything wrong, and there's going to be something positive come out of this experience, and I firmly believe Owen is going to be okay. This is a nurse I trusted. I mean, she was fantastic, and that really made me feel better. If somebody passing in the hallway said, oh, your kid's going to be all right, I'd been like, yeah, what do you know? But hearing it from a nurse that I trusted was very supportive and very helpful. And she was right. Yes?
What have you and the family done for grief?
What have we done for grief? Cried. Not the wrong things. We have not sought mental health care. What have we done for our grief? We've held on to each other. And I will tell you, the thing about cancer is it holds you hostage. It never lets you go. And my best friend that I had on one of those slides at the beginning, her grandson had leukemia. And if he gets a fever, the entire family immediately thinks leukemia is back. And it's not. He's in full remission. But it just, there's something about cancer and pediatrics. It never lets you go. So when my husband called me to say, hey, we're at the voting site and Owen has had a seizure, the first thing he said to me was, Owen is okay. And I went, all right. But I could just feel it getting ready to come out of me, like I knew he wasn't. But then when he told me he had a seizure, I was like, oh, well, that's probably scarring from this. Like, I couldn't think like a nurse because I didn't see anything that made me think that. But we all, I mean, my son was just devastated when he was diagnosed with this seizure in February. He just went all to pieces, and my daughter-in-law was like, yeah, we're okay. And different ones take over driving the ship. We'll use buccaneer analogies. But it's really important that as nurses, just because we're nurses, somebody should have told us to get help, you know. And we know it intellectually, but we're choosing to be each other's help and work through it that way. But yeah, grief and working through grief, there's a theory of chronic sorrow that's very interesting. It talks about grief, but We had a miracle. He's fine. He takes seizure medicine. He doesn't have seizures. We're good. But we do still have some residual grief to work through. Thank you for recognizing that.
How did you get through the fear of like making another mistake? Like when you're with another one of your patients, how do you not be so?
Oh, that is such a great question. And like I have a literal example from 2 weeks ago. The question was, how do you get over that fear that you're going to make a mistake when you're with a patient? I had a patient that told me he had a cut in his groin, and when I laid him on the exam table, and I had a student with me, and he dropped his knee over so I could see the cut, it was a tunneled abscess down the side of his scrotum, and it looked to me like it was going back behind, like the pubic bone. And I barely touched it, and he went, oh! And I said, yeah, you're going for a CT scan. This could be a tunneled abscess. And the student said, well, how did you know to do that? I said, because I don't play. If it doesn't look right now, I'm not trying to make that mistake again. If it doesn't look right, it's not right. And so he went and he got a CT, and they gave him a IM injection of Roberson and started him on some antibiotics, and it's like almost completely healed. It was not tunneled, but it was bad. It might have tunneled if I had said, well, let's just try a little saline packing. You know, I said, this doesn't look right. Otherwise healthy adult male, nope, going away from here, getting a CT. Excellent question. All righty. Thank you so much for your attention. You have my email.
Thank you very much for being with us, Dr. Roberson, and your great insights into the nursing profession. Before we close the program, we want to present you with the Pattie Browdership Lecture Award, a token of our gratitude for your time and expertise in the matter of what it means to be a nurse. Opportunity to ask any other questions. The questions that you all have posed have been so beneficial to everyone in the audience. So anyone a little afraid to ask a question before we close out, would love to hear from you. Yes, thank you.
Is there something specific through that whole experience that looking back now you would tell to yourself that just graduated and was just starting to actually get into practice?
As a new graduate, I had a whole lot of what has been called imposter syndrome, where even though I passed the NCLEX, I could write RN behind my name, I kind of knew stuff. I did not feel like I had any business being in control of patients' lives and being between them and death's doorstep. And what I learned through more experienced nurses is I did have the knowledge and I needed to trust it. So that's why I say don't underestimate your instinct. Don't think because you're a new graduate, you have not developed clinical judgment. I think your faculty here would beg to differ. They've worked very hard with you in clinical to develop your clinical judgment. So I would say trust yourself. Go to a nurse that's working with you that you trust and say, hey, I think this is going on. Am I right? Am I wrong? How would I know? I don't want to miss something. Someone that you trust that's a good support for you. But you have just got to trust yourself. You're at an excellent college of nursing. You're getting an excellent education. You got to trust that. You trusted your education with the faculty here, and they're giving you what you need. That's a very good question.
How do you separate between the, I guess, especially after an experience like this, how do you separate the anxiety that might come with, dealing with patients that might have cancer because you're family practice, so you have to deal with people in all stages of life. So how are you able to separate that in a professional setting when it might not necessarily have anything to do with the patient themselves?
Yeah, so the question is, how do you separate yourself from your experience with cancer and maybe another patient and their family dealing with cancer or serious diagnosis? So the wonderful thing about nursing is we are holistic, and so our life experiences inform our nursing practice, and that is a wonderful thing. And I'm not saying other healthcare professions are not like that, but it is especially true for nursing. And while I would not go up to someone, and I'll tell you, there was someone in the neighborhood whose child had a brain tumor, but they had to go through the child's nose. It was in the center of their brain. It was not a pituitary tumor. It ended up, it's not the best case scenario. But they called me asking for advice. And how can we get the diagnosis and get the outcome that you got with Owen? And I said, well, see, that's the thing about the human body. Everybody's different and everybody's different. So what I try to do is say, I'll share this story, I'll just say not very often if I'm delivering bad news, because it should be focused on that patient and family and their news and how they handle it. But as we get to know each other, as we're moving through the journey, if they're saying, I bet you've never experienced anything like this, I can say, well, I have. And what was helpful to me was the nurses standing up for me. And I try to share the things that were helpful without going into necessarily Owen's story. But that is a very good thought there. Well, I'll hang around if anybody is shy and wants to come up and ask another question, but I appreciate your attention. I appreciate this wonderful opportunity. I hope it met your expectations, and I hope you learned a little something from Owen. Thank you.
Before we close, for those of you that wish to be awarded Nursing Contact Hour, and I think, let me see if I advance this. Let's see. There's supposed to be a barcode on the screen.
Did you all sign when you came?
Okay. So we'll get that to you for sure. But again, thank you all for joining us today. I hope it had as much of an impact on you as it's had on me. And keep an eye out for the announcement for the 3rd annual 2025 Pattie Latham Browder Lectureship that will be planned soon. Thank you.